Audible and visible to you? Okay. So, myself, Dr. Shital Ghataliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. With iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, you will find various resources like well-structured live batches, recorded classes, competitive live tests and quizzes, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now Unacademy came up with some special class feature. Now classes will be highly interactive. There will be a facility of poll for the learner. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it. And you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. As I told you, there is a highly effective question bank. Updated question bank is there. More than 25,000 high yield clinical questions are there, which are based on latest exam pattern, and it includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy. As I told you, there is a raise the hand feature. Now classes will be highly interactive. You will be engaged with the quizzes, viva, doubt solving, and many more. Unacademy Medical PG test is there, free test to choose, where you will find educator curated test series, FMG grand test series, study with me YouTube test series, and many more. Plus which test to choose, you will find NEET PG 2022 subject wise test series, NEET PG 2022 grand test series, and many more. So there are two batches. Focus FMG 2022 comprehensive batch. Duration is 6 months. Already started from 15th of December. Target NEET PG 2022 test and discussion batch. Duration is 3 months. Already started from 15th of December. So both the subscription, iconic subscription and Plus subscription, both are available with various duration and different prices. You can choose it accordingly. Use the promo code Shital10 to get additional discount. As I told you, there is a free test on Unacademy educator curated test series. Different scholarships are available for various ranks. You can check with the time and date and different subjects. Use the code Shital10 to unlock the free test. Use the code 872878 to attend the quiz on app. Now you can go for the mock test NEET PG 2022. You can taste your preparation journey. All India mock test is there. You can enroll in it. Use the code NPG10 for this. So you compete and taste your preparation. Use the code NPG10. Enroll with this code. So now come to today's topic, that is hemopoiesis. Understand the word carefully, hemopoiesis, and later I will cover erythropoiesis. Now hemopoiesis, let us understand the first one, hemopoiesis. Hemo stands for blood, right? Hemo stands for blood, and poiesis means formation of blood cells. Poiesis stands for formation. Okay, and hemo stands for blood. So hemopoiesis occurs in the bone marrow. It occurs in bone marrow. There is a pluripotent stem cells. Understand the word carefully. Pluripotent stem cells. The stem cells which are forming units. It will form the colony forming units. Colony forming units for erythrocytes and different WBCs. Different WBCs like basophil, eosinophil, monocyte, and granulocytes. Okay, and lymphoid series will form T and B lymphocytes. Okay, it will form T and B lymphocytes. Okay, so pluripotent stem cell, those stem cells which are capable to divide in many. So it will first divide into two series, myeloid stem cell and lymphoid stem cell. Then myeloid stem cell will form different colony forming units. Okay, different colony forming units will be formed, and for erythrocyte and different white blood cells like basophil, eosinophil, monocyte, neutrophil. Okay, and the lymphoid stem cell will divide and it will form mature T lymphocyte and B lymphocyte eventually. So that is from the bone marrow. Now, the growth of these different blood cells, the growth of these different blood cells from the stem cell is controlled and regulated by different growth factors. Different growth factors. These growth factors which are regulating the process of hemopoiesis, that is called as a cytokines. They are called as cytokines. So cytokines is a gross term which is used for the proteins. Cytokines is a gross term which is used for the proteins released by the cells, and they act as a mediator, intercellular mediators. So these colony stimulating factors are there. Cytokines, which controls the formation of the different types of the blood cells, are together called as a colony stimulating factor. So there are different colony stimulating factors for different series of the series, is like the colony forming unit, eosinophil, colony forming unit, erythrocytes. Okay, colony forming unit for basophil. So there are different colony stimulating factors, or you can say cytokines, for each series. Okay, which causes which stimulates the formation of that individual cell. So this is all about hemopoiesis. Now come to the next topic, that is erythropoiesis. Understand the word carefully. Erythropoiesis. Erythro stands for red blood cells. Right? Poiesis. Poiesis means formation. Right? Erythropoiesis means formation of red blood cells. There are different stages of erythropoiesis at different stages of life. Okay, intrauterine life, after birth, and in the adult age. So these stages, intrauterine life, in the during the intrauterine life, there are various stages. There are three different stages. That is mesoblastic stage, then hepatic stage, and myeloid stage. Okay, there are three stages: mesoblastic stage, hepatic stage, and myeloid stage. Mesoglostic stage is a stage where the erythropoiesis occurs in the mesoderm of yolk sac. It occurs in mesoderm of yolk sac. Okay, it occurs up from the early embryo up to 3 months of intrauterine life. Okay, occurs in the mesoderm of the yolk sac. Here it occurs, the RBC formation occurs inside the blood vessels. So also called as a intravascular erythropoiesis. Okay, intravascular erythropoiesis. This is the only stage of life in which erythropoiesis occurs inside the blood vessels. Okay, called as intravascular erythropoiesis. This is important from MCQ point of view. This is this stage in the early embryo up to the third month of the intrauterine life, erythropoiesis occurs inside the blood vessels, called as a intravascular erythropoiesis. Later on it is extravascular erythropoiesis. Now come to the next stage. From the third month of the intrauterine life to the middle of the fetal life, it occurs, erythropoiesis occurs in liver. That is called as a hepatic stage. That is the hepatic stage of erythropoiesis. Then from the middle of the fetal life to the till birth, it occurs in the bone marrow. Okay. Then in children and in adult, erythropoiesis occurs in red bone marrow. It occurs in red bone marrow. Red bone marrow, you can say, is an active bone marrow. Okay, here the from the stem cells, different cells can be formed. Okay, different types of blood cells can be formed. Erythrocyte, different white blood cells, platelets, and all. Right. So this is all about the stages of the erythropoiesis. So if we want to compile it, the way how we can compile, there are three stages of erythropoiesis at the different stages of the life. Okay, one is during the intrauterine life, another one is during the childhood period, and later on in the adult phase. Intrauterine life, again there are three stages. First one is a stage mesoblastic stage, then hepatic stage, and myeloid stage. Mesoblastic stage is a stage in which the erythropoiesis occur inside the blood vessel, so also called as a intravascular erythropoiesis. Hepatic stage, from the middle, this occurs up to the early embryo up to the first 3 month, third month. Then third month to the middle of the fetal life, it occurs in the liver. Extravascular erythropoiesis, this is hepatic stage. Then myeloid stage, it occurs in the bone marrow. Okay, from the middle of the fetal life and later on. So this is the myeloid stage. This is all about the intrauterine life. After birth, in childhood phase, it occurs in the red bone marrow. Red bone marrow is the bone marrow which is you can say active bone marrow, where you will find the stem cells, and it will help in the formation of different blood cells, right? And in the adult phase also, red bone marrow. Okay, where this red bone marrow will found, it will be there in the end of the long bones, in flat bones of the body. Flat bones like vertebrae, ribs, sternum, okay, skull, these all are the flat bones. So here you will find red bone marrow. So this is about the different stages of erythropoiesis. Now come to the stages of the formation of the mature red blood cell. So as I told you, from the pluripotent stem cell, there will be a formation of the series. Okay, colony forming unit will be there for the erythrocyte. Now this stem cell will form pro-erythroblast. It will first form pro-erythroblast blast cell. Then from pro-erythroblast it will form early normoblast. Then intermediate normoblast, then late normoblast, then reticulocyte, and mature RBC will be released into the circulation. So this proerythroblast is a very large cell. Okay, proerythroblast is a very large cell. Diameter is approximately 15 to 20 micrometer. 15 to 20 micrometer. And here the cytoplasm is basophilic. Okay, as the process of formation goes on, the cell size will reduce, then nucleus will become condensed, and there will be the change in the nature of the cytoplasm. Okay, so proerythroblast is 15 to 20 micrometer in diameter and cytoplasm is basophilic. Then when it reaches to the intermediate normoblast stage, the diameter becomes 10 to 14 micrometer and cytoplasm will become polychromatophilic. Okay, cytoplasm will become polychromatophilic and hemoglobin will appear. At this stage, hemoglobin will appear. This is again important MCQ. Hemoglobin appears at which stage of erythropoiesis? It is intermediate stage. Okay, intermediate normoblast stage of erythropoiesis where hemoglobin appears. Then later, after the intermediate normoblast, there is a stage of late normoblast. Late normoblast, here the cell size will become 8 to 10 micrometer. It becomes 8 to 10 micrometer and nucleus becomes pycnotic. Okay, it becomes pycnotic. Then the reticulocyte stage. Reticulocyte stage is a stage where you will find the remnants of RNA. Okay. A small amount of RNA is present in the cytoplasm of the cell. Okay, reticulocyte, that even the size of the cell becomes smaller. Reticulocyte in this only the remnants of the RNA is present. There is no nucleus, no other cell organelles will be there. Later on, it will causes the formation of mature red blood cell. Mature red blood cell where there is no nucleus, no ribosomes, no endoplasmic reticulum, no mitochondria. Okay, nothing like a typical cell. You will not find anything like a typical cell in mature red blood cell. So this way you can conclude. If we want to conclude, then how we will conclude this entire thing, entire erythropoiesis? From the pluripotent stem cell, there will be formation of proerythroblast. The proerythroblast size is very big. Okay, 15 to 20 micrometer and cytoplasm is basophilic. Then it from proerythroblast, it will cause formation of early normoblast. Then intermediate normoblast. Intermediate normoblast is a stage where the cell size is 10 to 14 micrometer. Cytoplasm is polychromatophilic and hemoglobin will appear. This is again important point to remember. Hemoglobin will appear in the intermediate normoblast stage. Then there will be formation of late normoblast. Late normoblast, even the cell size will reduce 8 to 10 micrometer and nucleus becomes pycnotic. Now it will extrude this nucleus, right? So, or you can say pycnotic nucleus, gradually it will disappear. So late normoblast is the stage where mitosis will stop. Cell size will become 8 to 10 micrometer in diameter and nucleus will become pycnotic. Later, there is a formation of reticulocyte. Reticulocyte, even the cell size will become smaller and only remnants of the RNA are present. Apart from that, there is nothing like a typical cell. From reticulocyte, there will be formation of mature red blood cell. This mature red blood cell is approximately 7.2 to 7.4 micrometer in diameter. There is no nucleus, no ribosomes, no endoplasmic reticulum, no mitochondria, nothing like a typical cell you will find. Okay, so this is how the mature RBCs will look like. Okay, mature RBCs will look like. See, they are disc shaped. Disc shaped, non-nucleated structure. Okay, disc shaped non-nucleated structure. entire process of erythropoiesis will take approximately 7 days. This is important. It will take 7 days. Okay. Till reticulocyte, from the proerythroblast to the reticulocyte stage, it takes 5 days to form. Okay. And from the reticulocyte to mature RBC, it takes 2 days. So entire process of erythropoiesis will take 7 days. Okay. Now come to the regulation of erythropoiesis. How erythropoiesis is regulated. There are various factors. See, general factor and special maturation factor. General factor means the one which affects the entire overall. Okay, so that is hypoxia. Hypoxia means lack of oxygen at tissue level. Special maturation factors like dietary factors, intrinsic factor and extrinsic factors, this I will be discussing in detail. Hypoxia, let us go through the hypoxia first. Whenever the tissue suffers from hypoxia, it will cause release of the hormone that is called as erythropoietin. Erythropoietin will be formed. Okay, the site of the, this is important from MCQ point of view. Site of synthesis of erythropoietin is a juxtaglomerular cells of the kidney, liver, cells of the tissue macrophage system. Approximately 85% of erythropoietin is formed by juxtaglomerular apparatus of the kidney. The rest of the 15% of the erythropoietin is formed by liver and cells of the tissue macrophage system. Erythropoietin is a hormone. So, if we see how the erythropoietin will be formed, let us see this. Whenever there is a hypoxia, hypoxia will cause the decrease in the blood flow, right? So same time renal circulation will also compromised, right? So kidney will also suffer from hypoxia, right? So it means renal hypoxia will cause release of renal erythropoietic factor. It will cause release of renal erythropoietic factor. Now, liver synthesizes erythropoietinogen. Okay, released renal erythropoietic factor will cause, it will act on erythropoietinogen and convert it into erythropoietin. It will convert it into erythropoietin. So renal hypoxia causes release of renal erythropoietic factor. Renal erythropoietic factor will act on erythropoietinogen. Try to recall the plasma protein part. Erythropoietinogen is alpha globulin, which is present in the blood, synthesized by liver, present in the blood. Erythropoietinogen will get converted into erythropoietin by action of renal erythropoietic factor. Now, what this erythropoietin will do? Erythropoietin will act on erythropoietin sensitive stem cells. It will act on erythropoietin sensitive stem cells and convert it into more and more proerythroblast. It means it will divert the stem cell series towards the proerythroblast. Okay, so that is the one action of the erythropoietin. The another action is it will promote HB synthesis. It will promote HB synthesis by increasing the globulin synthesis. Okay, by increasing the globulin synthesis and by potentiating the action of the enzyme delta amino levulinic acid synthetase. So overall is it increases, promotes the hemoglobin synthesis. So first action is it converts, it diverts more and more stem cells towards the formation of proerythroblast. Second function, it increases, it promotes the hemoglobin synthesis. Third function, it promotes all the stages of maturation. It enhances the all the stages of the maturation of the RBCs. So overall duration of the erythropoiesis will be reduced, and it promotes the release, more and more release of RBCs from the bone marrow into the peripheral circulation. So this is all, these all are four important actions of erythropoietin. First one, it promotes the more and more diversion of the stem cell series towards the formation of proerythroblast. Second, it promotes hemoglobin synthesis. Third, it promotes the every stage of maturation of the RBCs. Okay, from the normoblast, pronormoblast, it promotes the formation of mature RBCs. And fourth action, it promotes the more and more release of RBCs from the bone marrow into the peripheral circulation. So different factors which can cause increase or decrease in the erythropoietin secretion. This is important again, very important. Hormones, different hormones like androgens, thyroxine, growth hormone, adrenocorticotropic hormone, prolactin, glucocorticoids, all enhances the erythropoiesis, increases the erythropoietin secretion. If it increases the erythropoietin secretion, means it increases the erythropoiesis, increases the more and more RBC formation, right? All the hormones except, you can say here, estrogen. See this one, estrogen decreases the erythropoietin secretion. It means it decreases the RBC count, right? So it in how the estrogen will act is, estrogen decreases the erythropoietic response to hypoxia, and it decreases the hepatic synthesis of globulin, right? So this way it overall it decreases the RBC formation in female. That's why females are having a lower count, right? The another factor which can increase the secretion of erythropoiesis is hemolysis. Hemolysis are the product of RBC destruction. Okay, so it increases the erythropoiesis. Different nucleotides, vasoconstrictor agents like because of the vasoconstrictor agent, it reduces the blood supply, right? So it will give a sense like a hypoxia. So it increases the erythropoietin secretion. So apart from these all increase in the secretion, the only hormone you can say here is estrogen, which decreases the secretion of erythropoietin, and adenosine antagonist, certain medicines like adenosine antagonist like theophylline. Theophylline decreases the erythropoietin secretion. Okay, so this is all about this is very important MCQ here is about the hormone. Okay, androgen, growth hormone, thyroid, thyroxine is adrenocorticotropic hormone, glucocorticoids, all increases the erythropoietin secretion, means it increases the erythropoiesis, means increases the RBC count. Here estrogen decreases the erythropoietin secretion. So this is important from MCQ point of view. Hello Ishu, happy to see you. I am good and I hope you are also doing well. So this is here, I am discussing here when important MCQ about erythropoietin secretion, hormones, androgen, growth hormone, adrenocorticotropic hormone, glucocorticoids, all increases the erythropoietin secretion. So increases the erythropoiesis. Estrogen decreases the erythropoietin secretion, so decreases the erythropoiesis. Now come to the spatial maturation factor. Understand the word carefully. Spatial maturation factors. So here comes the role of the different dietary factors. Try to recall the hemoglobin synthesis. different dietary factors like proteins. Proteins are important for the polypeptide chain synthesis, right? Then calcium. Calcium is important. Iron is a part of hemoglobin. Vitamin C. Okay, these all are important. Vitamin C is needed for iron absorption from gastric juice by its action on the stomach, right? So that is the one factor, dietary factor. The another one is Kessel's intrinsic factor. Okay, see this one, Kessel's intrinsic factor. The intrinsic factor is important for vitamin B12 absorption. Okay, whenever you consume vitamin B12, when it reaches to the stomach, vitamin B12 intrinsic factor complex will be formed. Okay, this vitamin B12 intrinsic factor will reaches to the small intestine, and from there the intrinsic factor will be removed and vitamin B12 will be taken up into the blood. So that is important, right? Kessel's intrinsic factor. If Kessel's intrinsic factor is not there, then vitamin B12 absorption will not occur. Okay, so the person will suffer from anemia. That anemia is called as megaloblastic anemia, right? So that is about the Kessel's intrinsic factor. Now come to the extrinsic factor. Extrinsic factors like vitamin B12 and folic acid. These two are needed for the nucleic acid synthesis, right? So this is important. These all factors, maturation factors, are needed. So for the RBC overall effect, if we conclude this now, that what are the factors which are regulating the erythropoiesis, factors regulating. In exam full questions is asked like this, right? Define erythropoiesis, write different stages of erythropoiesis and factors regulating erythropoiesis. So if it is asked, how we will write? Define means write down definition of erythropoiesis means it is erythropoiesis is defined as a process of formation of mature red blood cells. Then different stages that we already discussed, that from pluripotent stem cell there will be series of the formation of different stages. It will pass through the different stages, right? Colony forming unit will be there. Then there will be formation of proerythroblast, early, intermediate, late normoblast, reticulocyte and mature RBC. Overall duration, overall process of the formation of the mature RBC will take around 7 days, right? It will take around 7 days. So that is for the about the process. Okay, the important point here which you are supposed to remember is at the intermediate normoblastic stage hemoglobin appears, right? And in the reticulocyte only remnants of RNA are present. Apart from that there is nothing like a typical cell, right? So this is important. In the stage of late normoblastic stage mitosis stops. Okay, so these are important points which you are supposed to remember. Proerythroblast size is 15 to 20 micrometer. When it forms the mature red blood cell, mature RBC size is 7.2 to 7.4 micrometer, right? So as the process of erythropoiesis goes on, then the cell size will reduce. Okay, nucleus becomes condensed, finally it will disappear. At one stage hemoglobin will appear, right? In the reticulocyte there will be only remnants of RNA, and then there will be the formation of mature RBC, which is the disc-like structure. No nucleus, no mitochondria, no endoplasmic reticulum, no ribosomes, nothing like a typical cell. So that is about the stages. Now factors regulating. So for factor regulating, you can write down it like this. For the factors regulating the erythropoiesis, you can write it like this. There is hypoxia, general factor, and spatial maturation factor, right? Hypoxia, when there is a renal hypoxia, It will cause release of renal erythropoietic factor. It will act on erythropoietinogen and which causes formation of erythropoietin, right? It causes formation of erythropoietin. Now erythropoietin is having list of functions, right? It is having list of functions like but the overall effect you can say here is increase in the RBC count in circulation. Increase in the RBC count in circulation. Make more and more RBCs available in the circulation, right? So that is about the renal hypoxia. Then special maturation factor. Again here there are three parts: dietary factors, Kessler's intrinsic factor and extrinsic factor, right? Dietary factors, like here you can write down like this, that protein, calcium, iron, vitamin C, all are needed. So protein is important for the polypeptide chain synthesis of hemoglobin. Calcium is needed. Iron is needed. It is also a part of hemoglobin. Vitamin C is important because without vitamin C, iron absorption will not occur. Again, vitamin, this is again very important point you are supposed to know is vitamin C deficiency also causes anemia. Why? Because it affects the iron absorption. Because vitamin C in the stomach, in presence of vitamin C and by gastric juice, the ferric state of the iron will get converted into ferrous state, right? That is the absorbable form of iron. Without that, iron will not be absorbed. So deficiency of vitamin C will cause iron deficiency anemia. So that is very, very important point to know. Okay. Then apart from that, Kessler's intrinsic factor is needed for vitamin B12 absorption. As I told you, it will form the complex intrinsic factor, vitamin B12 complex. Without this, vitamin B12 absorption will not occur. Okay, whatever you will consume, it will get excreted out of the body, okay, without getting absorbed. So intrinsic factor is must. Okay, and extrinsic factors like vitamin B12 and folic acid. Okay, they are also a maturation factor. They are important for the nucleic acid synthesis. So this is all about erythropoiesis. If you have any question, you can ask me. If you have any question, you can ask me. If you want me to repeat anything, I will repeat that. Okay, so in that case, I would like to highlight the important question which can be asked from in exam. Is the stages of erythropoiesis. At which stage of life erythropoiesis occurs inside the blood vessel? It is the early stage, during the early stage of the life. Okay, from the early embryo to the middle of the to the first 3 months of the intrauterine life, where erythropoiesis occurs inside the blood vessels. Okay, that is intravascular erythropoiesis. Intravascular erythropoiesis occurs in early embryo up to 3rd month of intrauterine life. Okay, hemoglobin appears at the intermediate normoblast stage of erythropoiesis. Mitosis stops at late normoblast stage. Reticulocyte contains the remnants, okay, remnants of the RNA. So mature RBC is 7.2 to 7.4 micrometer in diameter, no nucleus, no ribosomes, no endoplasmic reticulum, nothing like a typical cell. Okay. Whenever the tissue will suffer from hypoxia, it will cause release of erythropoietin. Erythropoietin is a hormone. 85% of the erythropoietin will be secreted. Site of synthesis is juxtaglomerulus of the kidney. Okay, juxtaglomerular apparatus of the kidney. 15%. Somewhat it can be synthesized in liver and in the cells of tissue macrophage system. Hormones like androgens, growth hormone, adrenocorticotropic hormone, glucocorticoids all increases the erythropoietin secretion. So increases the erythropoiesis means RBC count increases. Estrogen decreases the erythropoietin secretion. So decreases the erythropoiesis and RBC count will be reduced. So this is very important point here again. Vitamin C deficiency can also cause anemia because it affects the iron absorption. Okay, without vitamin C, iron will not get converted. Iron will be converted into soluble form. Okay, in stomach, in presence of gastric juice and vitamin C, both are needed. Gastric juice and vitamin C. Okay, so it will convert ferric state into ferrous state. Ferrous state is a soluble form of the or you can say absorbable form. Okay, Fe plus 2 state is a absorbable form of the iron. Okay, so that is needed. Otherwise, if vitamin C deficiency is there, then it will cause anemia. Vitamin B12 and extrinsic factor are important for the nucleic acid synthesis. Kessel's intrinsic factor is needed for the vitamin B12 absorption. Extrinsic factors are vitamin B12 and folic acid needed for the nucleic acid synthesis. So this is all about hemopoiesis and erythropoiesis. I hope all of you understood everything. Join me at 9:45. I will be there for the query discussion in open house session. So you can ask me whatever is your question. So join me in open house session. It's 9:42. I will be there in open house session for the discussion. This is the audio classroom available on the Unacademy app. Join me. You can talk to me and you can ask your query for the topic whichever I covered today, hemopoiesis and erythropoiesis. Okay, study hard, study with us, study with me. Subscribe Unacademy Future Doctors channel and help us to reach to more and more number of students. Thank you so much.